Hello, Dr. Vikki Petersen here. I wanted to speak with you today about a problem that we are seeing more and more here at the office. We practice root cause medicine, and what that means, kind of the way it sounds, it's getting to that underlying root cause of why a problem is being created. And the issue I wanted to speak to you about today is very interesting because it's very commonly either it remains undiagnosed, so someone continues suffering, or misdiagnosed. And it encompasses the two most common reasons patients come to see us here at the clinic, which is either pain or digestive issues, and it actually encompasses both. So it's called a hiatal hernia. A hiatus just means a hole. A hernia means when something is protruding through a hole. You've maybe heard of abdominal hernias or inguinal hernias. A hiatal hernia is a little anatomy. So the mouth connects to the stomach through a tube. It's called the esophagus, and there's something called your diaphragm, and that's the best way to think about that is sort of a sheet of muscle that is running through the body, and the heart and lungs is above this sheet of muscle, and below it are the digestive organs. And the diaphragm never gets a break because, of course, we never stop breathing. So when you inhale, you take a deep breath in, it bows down, and then as you exhale, it comes up, pushing the air out of your lungs. So the diaphragm, needs to smoothly move constantly in order for you to get enough air. So you've got the diaphragm. Just below it, you have the stomach. The stomach's a little bit on the left side. And what can happen is in a frank or a severe hiatal hernia, the stomach actually pushes up through the hole where the esophagus comes, so it pushes up above the diaphragm, and you can see that on scans, and that requires surgery to close the hole back up again because the big part of the stomach at the upper part has pushed through it. So that's surgical. You can, as I said, you can see that, so it's not hard to diagnose. However, what I'm talking about are mild hiatal hernias where the stomach is not up through the diaphragm, but it's pushing against the diaphragm. So why does that cause problems? Remember that diaphragm needs to smoothly move in order for you to breathe. So if the stomach is pushing up against it, it's kind of in spasm, so it's not moving that well. What kind of symptoms can be associated with that? You can actually have the abdominal pain in the stomach area. You can have chest pain. You can have shortness of breath because, of course, because the diaphragm's not moving freely, you're not getting that full, easy air. You can have panic attacks, again, because not enough air. What else can you have? Hold on, let me check. Trouble sleeping, because at night you're horizontal and the stomach is pushing up against the diaphragm, and so people can wake up with panic attacks or just know that they're uncomfortable, shortness of breath once again. And then there's digestive disturbances associated with it. You can get lightheaded, once again, because of not enough air, or dizziness. So all these various symptoms with one problem that's completely easy to fix. So what happens is either someone has panic attacks or the lightheadedness and the dizziness, and they're quickly given antidepressants, anti-anxiety medications, which of course have horrible side effects, dangerous side effects, and they do not need them. They have abdominal pain, so they're given antacids and things like that, which compromise their ability to digest properly. Again, things they don't need. So they're given a lot of different treatments that are not answering the question, the root cause problem. So of course, we now know what it is. That stomach is pushing against the diaphragm. So what do we do about that? There's a couple different things. One, the stomach might be pushing up against the diaphragm because it's spasmed. So it's contracted, and so it moves up because of that. So of course, not a silly question, but what goes in the stomach? What you eat, food. So if you're having a food sensitivity, a food reaction, that can create that spasming. Another thing, there's a common infection in the stomach called H. pylori. It's a bacteria. You can get a blood test for that. That can cause spasming and inflammation of the stomach. So we've got food, we've got an infection, and then we have, people who are constipated. So if you have digestive issues and your bowels are not moving as frequently as they should, that bearing down that people do to kind of help that stool pass, that creates increased internal pressure in the abdomen area, and that can cause the stomach to go up. And what's so interesting about treating hiatal hernia is as a root cause medical clinic where we have internal medicine, clinical nutrition, chiropractic, physical therapy. This is a condition that encompasses potentially all of those practitioners. And as I said, we've been seeing it more and more, which is really why I wanted to talk about it. So the nerves that go to the diaphragm itself to make sure it and the brain are connected correctly, those nerves come from the neck. So sometimes with the hiatal hernia, we find people have neck pain and that nerve is not functioning as well as it should. So that's where the chiropractic comes in. Also, as doctors of chiropractic, we learn, some schools learn it, some don't. I did, fortunately. We call it a stomach pull down, but it's a way to break that spasm between the stomach and the diaphragm, which gives people instant relief. It's very easy to do if you know how. So that's a mechanical thing that we do in addition to making sure the nerves are functioning properly. And then where physical therapy comes in is if the core is not strong, if you have weak abdominal muscles, weakened core muscles, you're more likely to have the hiatal hernia as well, because everything's not holding together in that area as well as it should. So you can see there's a lot of different facets to look at, but it's something we've done for such a long time. I've done an earlier video just on the panic attacks. But of late, we've seen so many people suffering, so I really wanted to put more information out there. So you want to seek out someone who knows how to diagnose this, knows what to do about it. If you need help finding somebody, that's what we're here for. Obviously, if you're local to us, we're in Sunnyvale, California, in Silicon Valley. We're more than happy to help. But we also see people from across the country. So just reach out, give us a call. Our number's 408-733-0400, but we're all about helping the busiest people in the world regain, retain, and reclaim their health, energy, and resilience to life, you know, to have a body that really works for them. So that's what we're about. We're happy to help you, and I hope you found this informative today. Let me know.